Very good afternoon. I'm very privileged to present here and share my experience of a case of intraocular and orbital cysticercosis. Uh, 45 years male from Bihar came on our OPD on 27th 2000 11 of 2020 with a complaint of gradual painless blurring of vision in his right eye, and it was for 6 months. There was no history of trauma, and there was no other ocular and systemic illnesses. On presentation, his visual acuity in right eye was 6 by 36, which did not improve on retinoscopy or pinhole, and in left eye it was a normal vision. Intraocular pressure was normal in both the eyes, and pupils were normal size and well reacting. There was no RAPD. On presentation of the right eye, we can see a mild congestion and pingicula on the conjunctiva. Otherwise, it was normal. On fundoscopy examination, on fundus examination, we can see there is a moderate amount of vitritis along with some tints of hemorrhages there, and on the superotemporal part, we can see a well-defined cystic lesion of grayish-white color, which gave a suspicion of cystic, like we are almost confirmed that it was a case of cysticercosis. Whereas the left eye was anterior segment was also normal, and fundus was also normal of the left eye. There was no vitritis in that eye. So we, since we suspected cysticercosis, we sent the patient for B scan, where we can see the cystic lesion with hypoechoic surrounding, and the central there is a hyperechoic lesion which suggested of scolex, and there was same type of lesion was also seen in the medial rectus. So there was cysticercosis in the vitreous cavity as well as in the rectus also. So we sent for the lab investigation. There was mild eosinophilia and raised ESR. Otherwise, other parameters were normal. And after a few days, we had done another blood sorry investigation, where we could we found there was a marked raised in the eosinophils, but here I could not get that report. So sorry for that, but there was a marked rise in the eosinophils in the other report also. So we started the treatment immediately with prednisolone. The weight of the patient was 60 kilograms, so we started with 60 milligram, which was tapered weekly, and from starting from the 60 mg, we ended with 10 mg OD, and along with that, he was advised to take albendazole 400 milligram BD for 4 weeks, and also pantoprazole 40 milligram OD for 4 weeks. And we also advised him to go for neurology consultation to rule out any cysticercosis in the brain, and also advised CT scan head and orbit. And we planned pars plana vitrectomy for the right eye. So he came with the CT scan report after a few weeks, and there was cysticercosis on the brain also, along with the rectus muscle of the both the eyes. And then he again, so as we had advised pars plana vitrectomy, he was not ready for that, and he lost to follow up, and but when his vision was started deteriorating, then he again came after a few weeks, and that time his vision was 666 in that right eye, and it was normal in the left eye. So we can see the vitritis has increased, and that obscuring the that cystic lesion was which was like clearly visible earlier was now a little um faint to visualize. So there is so that time he agreed for the surgery, and we went for the pars plana vitrectomy. Can we have the video, please? So we did his pars plana vitrectomy 23 gauge vitrectomy system. Here we can see the amount of vitritis there and the floating cyst. Uh, So it was my first case of doing vitrectomy in the cysticercosis cases, and I tried to remove it in toto, and I had like had seen many videos before doing that vitrectomy, and I my goal was to remove it in toto. So I was trying hard for that, and after clearing the vitreous from center and periphery, uh, it was some attachments in the periphery, uh, but there was no tear, and because the cyst was large, I make a sclerotomy and wanted to try to remove it, but it was a large in size and it was not coming. So eventually I only could remove the capsule, and central part fell down, and I removed it by cutter. So I could have made that sclerotomy larger, but I did not do that because it could um, bring more complications by doing more larger sclerotomy. So I cut it with a cutter. So that is so it was closed. The sclerotomy site was closed by 60 Vicryl, and then other ports were closed with 80. And specimen was sent for histopathology uh, call report, and that also suggested of cysticercosis. And patient was called on after 2 weeks, and that time enter segment was clear lens was clear, there was no cells and reactions, and there was mild congestion though, and intraocular pressure was also normal, and the main thing is visual acuity was 6.9 on that eye, and patient was very happy, and fundus was also clear. uh, Thank you. So patient was quite doing well. That after that, I could not trace him for the further evaluation, but I hope he is doing well. That's why he lost to follow up. Thank you very much. This is our beautiful hospital in Biratnagar called Biratnagar Eye Hospital. Thank you for your